Good morning. This is an email from Lucy. Lucy writes, I've had a complicated relationship with food since I was little, sneaking and hiding food, which developed into a full-blown eating disorder as I grew into a young adult. I used drugs to stop myself from eating between the ages of 21 and 23. I recovered from the drug use and gained some weight and then went on to develop an orthorexic and gym-addicted mindset, which is still hanging on now, age 28. In times of stress, I often find myself longingly looking up meal plans and diets. The thought of having all of my ingredients laid out and planned for the week or a month is somehow a thrill, even better if it excludes food groups. My disordered mind tells me it's better for budgeting, it's easier to cook when you have a planner, and it doesn't help that I was a professional chef for nearly a decade before recently changing careers. I felt it was better not to be around food professional setting anymore. The last 2 years I've been making an effort to allow eating as soon as I realise my mind is restriction, but some ideas always linger in the back of my head. I want to be optimally healthy, but am I eating enough vegetables? What if I become fat? I know that these are stupid thoughts, but obviously the eating disorder still has a hold on me. I'm sorry for the long email, but my question is, if I continue allowing all eating, will the thoughts eventually cease, as I feel that they are the only thing hindering my recovery? Well, kind of a no and yes. The continuing to eat without restriction, or as you said, allowing all eating, that's nutritional rehabilitation. It's also neuro rewiring though, because you're rewiring the tendency to not allow all eating and you're rewiring the tendency to restrict. So it's not the nutritional rehabilitation alone. It's not necessarily that you're eating the food that you want alone. It's the neuro rewiring piece as well, which helps you aid full recovery. So, and neuro rewiring has many levels, and on the one level it's sort of like the part of unrestricted eating, of eating what you want. That's actually something that you have to rewire, because you have a tendency, you over the years, when you have an eating disorder, we often don't eat what we want, and we eat towards our judgment, and we eat to a meal plan, and we have to rewire that by allowing ourselves to eat whatever the hell it is that we want. So that in itself definitely is neuro rewiring. Eating lots of different foods, eating different foods in quantities that doesn't feel safe, anything that doesn't really feel safe and that your eating disorder doesn't particularly like. That's sort of neuro rewiring. You're teaching your brain that this is all right to do, brain, look, I'm doing it, it's fine. But you also need to rewire the thought patterns, and that's where neuro rewiring goes into a little bit more of a subtle area. It's not quite as obvious, and this is where people struggle, I think, for obvious reasons, because it's not that obvious that you can actually rewire thought patterns, and that thought patterns are actually something that needs to be rewired. Behaviours are easier to rewire. The behaviour of restricting is easier to rewire than those back of the mind thoughts. Now, if you follow through with the behaviour of not restricting, then gradually those back of the mind thoughts are going to get less, usually, because your behaviours or your actions inform your brain. So that's good. But you also need to, whenever you notice that you're having those back of the mind thoughts, which is the hard bit, isn't it, detecting them, because like I said, they're back of the mind thoughts, then that's when you need to actively not engage in those thoughts. Like when you notice that you're having those thoughts around, I felt so like safe and nice and cozy when I had a meal plan and I was planning all of my meals, and that feels so nice. When you feel that you're going off on that thought train, you've got to bring yourself right back out of it. Don't indulge in it, because the thoughts that we pay attention to also informs our brain, and our brains learn from the thoughts that we pay mental attention to. And so if you're paying mental attention to those thoughts, your brain's going to conclude that those thoughts are important. We don't want your brain to think that those thoughts are important, because they're not. So you've got to kind of like pull yourself out when you're engaging with them. I'm not saying that's easy, but it is actually a skill that you can develop, the ability to recognize that you're thinking a thought and then pull yourself out of that thought. It's relatively the same as recognize, like, I've got this tendency to restrict and I'm going to push myself not to restrict, because you're having all these thoughts about should I eat this, shouldn't I eat this, and all that stuff. But it's just actually recognizing the thought patterns that are quite common to you. So in what you've emailed me there, you've talked about, oh God, I can't find the email as much now. But back of the mind thoughts. I want to be healthy, but am I eating enough vegetables? What if I become fat? It's easier to cook when you have a planner. It's better for budgeting to cook when you have a planner. Like meal plans feel good when they feel when they exclude food groups. So those are already some distinct categories of thought patterns or feelings that you know frequently come up. They've come up frequently enough that you've been able to recognize them and write them in an email to me. So what you want to do is you want to label those feelings. Oh, look, there's the meal planner feeling again. Oh, look, there's the fear of fat feeling again. Oh, look, there's the vegetable feeling again. And you want to label all of those so that when they come up, you can go, that's the vegetable one, shut up, I'm not listening to that. That's where I would start. Sounds like you're doing a pretty good job in recovery, Lucy. It's just that neural rewiring bit that is hanging on. Usually true for all of us. Okay, bye.